Today we're gonna talk about the hip bone, its parts, surfaces, muscle attachments, and nerve supply. This is internal surface of the left hip bone. So how do we know it's internal? We see the articular surface, the iliac fossa, the iliopectineal line. So this is internal. The notches are medial, so this is the left hip bone. Externally, we know that this is the external surface because we see the iliac tubercle. We don't see the iliac fossa or the articular surface, so this is the external surface. And again, the notches are medial, so this is the left hip bone. The hip bone is divided into three major parts: the ilium, the ischium, and the pubis. Okay. This is the obturator foramen. It's important to differentiate between the ischium and the pubis. The ischium has this spine and this big tuberosity. However, the pubis has a small tubercle and a small spine. Crest, sorry. Okay, so now talking about the important spots on the ilium. This is the iliac fossa. This is the iliac crest. This is the articular surface for articulation with the sacrum. It will form the sacroiliac joint. This is the anterior superior iliac spine, anterior inferior iliac spine. About 5 centimeters behind the anterior superior iliac spine, we have the iliac tubercle. This elevation, iliac tubercle. Externally, posteriorly, we have the posterior superior iliac spine and the posterior inferior iliac spine. Externally, anteriorly, we have the anterior superior iliac spine, and below that we've got the anterior inferior iliac spine. Greater sciatic notch. We can regard this also as part of the ilium. Greater sciatic notch. Now, moving to the ischium, important spots on the ischium. We have body, we have ramus. So this is the ischial body, this is the ischial ramus. Again here, this is the ischial body, this is the ischial ramus, this is the ischial tuberosity. It's on this part of the hip bone on which we sit. Ischial tuberosity. This is the ischial spine. This is the lesser sciatic notch. As we said, this was the greater sciatic notch. These two notches are turned into foramina by the sacrospinous ligament and the sacrotuberous ligament. Moving to the pubis, this is body, so this is the pubic body, superior pubic ramus, inferior pubic ramus, again, pubic body, superior pubic ramus, inferior pubic ramus. This is the pubic crest. This is the pubic crest. This small elevation is the pubic tubercle. This is the pubic tubercle. This is the pubic crest. It's important to note that this is not the pubic crest. This is just for articulation between the bodies or the pubic bodies of the two hip bones. Okay, this surface is for articulation between the pubic bodies of the two hip bones anteriorly. So this is pubic crest and this is pubic tubercle. This is the acetabulum. This is the acetabular notch. Acetabulum for articulation with the head of the femur to form the hip joint. Acetabular notch. Acetabular notch. Muscle attachments of the hip bone. This is the external surface. Gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata, sartorius, straight head of the rectus femoris, reflected head of the rectus femoris, obturator externus, on the external surface of the obturator membrane, adductor longus, adductor brevis, adductor magnus, on the ischial tuberosity, quadratus femoris, semimembranosus, semitendinosus. In between the semimembranosus and semitendinosus, there is long head of the biceps femoris. Long head of the biceps femoris. Gemellus superior. So see, there are three origins on the ischial spine. This, and also this. What we want is this one. This is the gemellus superior, and this is the gemellus inferior. gemellus superior, gemellus inferior. On the inferior surface of the pubis, anteriorly close to the symphysis pubis, we have the gracilis. Iliacus, on the iliac fossa, iliacus. This is the iliopectineal line. So if there's a spot on this, we say that this is the iliopectineal line. And this is the pectineal line, part of the iliopectineal line. So if there's a spot on this, we'd say that this is the pectineal line, this is the iliopectineal line. On the pectineal line, we've got origin of the pectineus muscle, pectineus. On the internal surface of the obturator membrane, we have the obturator internus, these two origins, this and this, obturator internus, obturator externus, externally, and obturator internus, internally. We're going to talk about the hip bones on the skeleton. These are the pelvic bones, so they are 4 bones, the 2 hip bones, the sacrum and the coccyx. Okay, so this is the coccyx, this is the sacrum. They are parts of the vertebral column. The right hip bone and the left hip bone. So the articulations of the hip bones, anteriorly the 2 hip bones articulate with each other at the symphysis pubis. This is the symphysis pubis. It's a joint. Symphysis pubis. Okay. Posteriorly, each hip bone articulates with the sacrum at the sacroiliac joints. This is the right sacroiliac joint, the left sacroiliac joint. So the part of the hip bones that take part in the articulation with the sacrum is the articular surface, as we talked about before. Articular surface. This is acetabulum of the hip bone for articulation with the head of the femur at the hip joint. Now it's important to indicate the right and left. So this is anterior view of the hip bones. We see the articular surfaces, the iliac fossae, the iliopectineal lines. So it is anterior, and we said that the notches are medial. Okay, the notches. See here again, greater sciatic notch, lesser sciatic notch. Okay, they are medial. So anterior, the notches are medial. So this is the right hip bone, and this is the left hip bone. Posteriorly, again, this is the sacrum, this is the coccyx. Coccyx, sacrum. So this is the posterior view. We know that because we see the iliac tubercle. This is the iliac tubercle. This is the anterior superior iliac spine, anterior inferior iliac spine, posterior superior and posterior inferior iliac spines. About 5 centimeters behind the anterior superior iliac spine is the iliac tubercle, this elevation. So because we see the iliac tubercle and we don't see the articular surface and we don't either see the iliac fossa, so this is the posterior view. And because the notches are medial, so this is the right hip bone. And it's the same for the left. So this is the left hip bone, posterior view, the iliac tubercle, this elevation, iliac tubercle, about 5 centimeters behind the anterior superior iliac spine. Okay, so this is posterior, the notches are medial, this is the left hip bone. This is the pelvic inlet boundaries, anteriorly the symphysis pubis, posteriorly the sacral promontory. This is the sacral promontory, this. Sacral promontory. And of course laterally the iliopectineal lines. Now we're going to talk about the nerve supply of the muscles that are attached to the hip bone. This is anterior view of the left hip bone. And this is the internal surface. Again, the internal surface. This is the external surface. External surface of the left hip bone. Okay, so now let's actually go ahead and talk about the nerve supply. Iliacus, sartorius, pectineus, straight head and reflected head of the rectus femoris. They are all supplied by the femoral nerve. On the internal surface, obturator internus, both of these, obturator internus, gemellus superior and gemellus inferior, and also the quadratus femoris. They are all supplied by the sacral plexus. Okay, and here the gluteus maximus is supplied by the inferior gluteal nerve, gluteus medius, gluteus minimus, and tensor fasciae lata are supplied by the superior gluteal nerve. Here on the external surface and the lower part, we've got some origins. So this is adductor longus, adductor brevis, adductor magnus, obturator externus, gracilis, and these are all muscles of the medial facial compartment of the thigh. So they are all supplied by the obturator nerve. But there's something that we have to note. The adductor magnus has got two portions. are two parts, the adductor part and also the hamstring part. Okay, so see, the one above is the adductor part or portion, the one below is the hamstring portion. This is because it is above, you can regard it as the adductor portion of the adductor magnus. So this is supplied by the obturator nerve. However, the hamstring portion, which is considered a part of the posterior fascial compartment of the thigh, is supplied by the tibial portion of the sciatic nerve. And here we've got three muscles: semimembranosus, this one, semimembranosus, semitendinosus, and long head of the biceps femoris. These are all muscles of the posterior fascial compartment of the thigh. They are supplied by the tibial portion of the sciatic nerve.